we decided to put together our first panel that would really focus on careers that you can get by leveraging an undergraduate degree. And we've got four recent graduates of the University of Vermont's Public Health Science program. In case I forget to say it, thank you all so much for agreeing to give your time to come and discuss your jobs with us. And so with that, I'll introduce the panelists. We have Christel Tonoki, who is a legal advocate with Steps to End Violence. Julia Pencek, who's a research associate for Pacific Institute for Research and Evaluation. Neva Cote, who is not a public health nutritionist, as I put on the flyer. That was my mistake. She is a chronic disease specialist working with the Vermont Department of Health, and she works out of the White River Junction office. And Lanie Billings, who is the Health Careers Program Director at Northern Vermont Area Health Education Centers, or AHEC. So with that, I would like to turn the presentation over to our panelists. And Dan, I don't remember if you set up an order for this. If
Yeah,
not,
we had said, I think we had Christel, Julia, Neva, and Lanie.
okay, that makes sense. I was going to call them off in the order that they're on the flyer. So with that, Christel, would you like to tell us a little bit about your job? And oh, for the group, what we're going to do here is do about 10-minute information session from each panelist, and at the end we'll have a pretty good chunk of time for questions. So if you have questions, if we can just hold those to the end, that would be great. Okay, thank you.
Okay. I'm like setting a timer and everything. Okay, hi everyone. My name is pronounced Christel Tonoki. I'm really happy to be here. No. That hurt a little bit. I'm really happy to be here and share a little bit about my journey. To provide a structure of my oral presentation, I'm going to be reading some notes that I compiled together so I remember everything. So first I'm going to talk about my admiration for public health, and then what I do, and then a little bit about myself personally and how I got into the field. So I truly believe that public health is the foundation of all the resources we use. Essentially, it's creating systems that promote the well-being of our communities. Not everyone has equal access or is knowledgeable of these resources, but everyone does have some sort of need that deserves to be met. And being involved in this field is being involved in helping people access those resources. Going into a little bit of what I do. So I work for a nonprofit organization called Steps to End Domestic Violence. Our mission is to assist in the transition to a safe, independent life for all of those who have been affected physically, sexually, emotionally, or economically by domestic abuse, and to promote a culture that fosters justice, equity, and safety. STEPS has a legal program, a youth program, a housing program, a support group program, and an education and outreach program. So I'll go into the legal program in a bit because that's what I am in. The youth program is, well, let me talk about the housing program first. So what STEPS does initially is we have a hotline, and when people call our hotline, they could be looking for a multitude of the services I listed, but initially they're looking for housing. And so we provide housing for people who have been impacted by domestic abuse. So they've lost their housing due to domestic abuse. Our people go through something we call a housing screening, and then if they are deemed eligible, then we get them set up in our system. If we don't have housing available, because people do use our housing, it fills up pretty quickly. It's not empty often. We connect them with economic services, and once we deem them eligible, they help them find housing with other services. So I don't know if you guys are familiar with like Cote in Burlington. That's the one we primarily direct people to if they're not a victim of domestic violence, but they still need housing. A lot of people call them, and unfortunately, a lot of people call us, and unfortunately, we have to deny them housing because we only serve people who have been impacted by domestic abuse. So yeah, that's our housing program. When people come, they come with kids. A lot of people, when they're fleeing they come with kids and they come with pets. Not every shelter allows pets, and people aren't going to want to leave their pets behind. So our shelter allows animals. So that's something that we're proud of, because it's really hard for people to find shelter that allows like cats and dogs, and we allow both. There was even a snake one time. We didn't know about it, but there's even a snake one time in somebody's room. So people have children, and we don't have like a daycare program set up, but if we call them service users, if a service user wants to have a meeting with somebody and there's nobody to watch their kid, we do have a lot of interns, and so we have a family/hotline intern that will watch their children while they're having a meeting. And we provide some parental support. That's the support groups. Parents can come together and talk about how to navigate parenting with their abuser. And I'll get into that in the legal side, but how to navigate parenting with how to, if you have a restraining order against their abuser, what does it look like to still have the other parent in the child's life, and just being able to speak to other people who are going through the same thing that you are going through is very important. And then the youth program focuses on like the children's ability to just, I guess, support and recognition for how hard it is for the child to be going through this. And again, I'll talk a little bit about the child part when I talk about how I got into public health. And the education and outreach program, I feel like just like any organization, we have people specialize in going into like schools and talking about domestic violence, describing what it is and how our organization can help those who are experiencing it. So I work as a legal advocate for victims of domestic violence. We support folks in the civil family division at court. This looks like helping people obtain relief from abuse orders, also known as restraining orders, parentage cases, public health, and child custody.
Let's try it their way. Let's end all this, and everybody go out on the free market and buy their insurance.
And can folks make sure to unmute their line? They are not the presenter.
And all you guys go out, jump.
I will go ahead and mute some of those lines. Here you go, Christel.
Yeah. Okay. The only time we would go into a criminal division is if a defendant were to violate their court order. So somebody had a restraining order issued against them and they broke that restraining order. That's when we'd go into criminal court, but we don't do that often, at least not since I've been there. I've been working with steps. I've been with steps for 2 months now, so I am very new. And so going back into the children aspect of it, we in my public health courses, we talked a lot about ACEs, adverse childhood experiences, and that's where the youth program is very important, because a lot of people will see children with disciplinary issues and this inability to focus, or even maybe like experiencing depression at a very young age, and it's like they are in a household where trauma is happening. They're watching their parent be abused. They might be experiencing abuse themselves. So it's our youth program, every program is vital, but our youth program is very vital because I feel like kids are very neglected in this process. They just kind of get written off as troubled, but they're in a situation that they didn't ask to be in. I mean, the person being abused didn't ask to be in the situation as well. But for children, like, they're especially vulnerable. So I graduated with my BS in Public Health Sciences from UVM in May. I'm currently getting my master's in Public Health, and I truly do not know what my life would have looked like if the public health program at UVM didn't exist. This program has really stretched my mind in a way to be able to think more critically, to know when to just sit back and observe. I feel like people don't do that enough. To listen with curiosity and understanding, and my least favorite, to research deeply. Ken used to always tell me it's been done before. So like, people would discover a new problem, and there are plenty of problems in the world to like go out and discover and want to fix, but they see a problem and they want to fix everything. That was me. I was like, oh, this is a thing that's happening, let's fix it. And it's important to be able to figure out what's already being done to combat the problem and to try and tackle an issue from a different angle, or even strengthen that fight by helping with the current potential solution. So just understanding that public health and even the work that I'm doing, it's a very slow process, but it's an important one. And something that is really important to mention is I was speaking with the outreach and education program coordinator, and we were talking about how we do direct service work. So I think we're very in it. So she gave me the analogy of the baby in a river. I don't know if you guys know it, but really quickly, like you're somewhere and there's a river nearby and you see a baby in the river and you pull it out. Okay, you see another baby in the river and you pull it out, and you see another baby in the river, you pull it out. Are you gonna keep pulling the babies out of the river, or go to the top and see who's throwing the babies in the river? And so we started talking about how the work we do, while it's essential and necessary, because like I said, we serve a lot of people, unfortunately, there is another program that one of my colleagues works for part-time called a call for change. So abusers like will call their hotline and be like, I'm not sure if I am abusing somebody, or can you tell me if this is abusive? And they kind of work to kind of rehabilitate themselves. And I know there are restorative processes and community centers in Burlington, and rehabilitation is something that we talk about a lot as a community, but I don't think it's something that's welcomed at all as a community. And so while I do help victims, I feel like I've been a victim of domestic violence, and I also know that I've harmed others. That makes sense. So I think it's very important, being in public health, to understand both sides of the problem. And so one of the faults that we talk about, me and my coworkers, or we say, it feels like nobody can call a victim an abuser and an abuser a victim. So we work with people, and we're not going to say, well, what did you do to escalate this? Absolutely not. But we just in general like want to be open-minded about the people who come to us, because there are times where the same people that our victims named abusers are also calling and trying to use our services. So if somebody is calling and saying that I'm being abused, but then somebody else said that they're the abuser, we're not going to turn them away. So I think the listening with curiosity and understanding is a very important skill to have in this job, along with the sitting back and observing. Yeah, and that sums up what I would like to say. I've reached my time. What I want to do, and I'm going to put it in the chat in a bit, is just state our hotline number. Like I said, this issue is more prevalent than I know. I've seen people I've seen people I never thought I would see in this line of work. So our hotline number is 802-658-1996. Again, I will put it in the chat. And it's 24/7, and you can ask for any of the programs that I mentioned, and somebody will help you get out of the situation that you're in, and you don't have to deal with it alone. So yeah, thank you.
Thank you, Christel. That was great. So we will move now, and I don't have the flyer in front of me. Dan, who did you want? Who did you have going next? Hey, Julie.
Hey.
All right. I'll turn it over to Julia.
Okay. Thank you so much, Christel. That was so awesome. So I have lots of notes I'm going to be reading off of, and I'm going to go through kind of my educational background, and then I'll talk about my job and my motivations and what brought me to public health. So my name is Julia Pencek, and I'm a research associate at the Pacific Institute for Research and Evaluation, which we call PIRE for short. It's a mouthful. And I just want to extend a big thank you to the Vermont Public Health Association for having me, and for everyone who's listening in. It's really awesome that this is here, and just echoing to, I didn't think that this is the field I would end up in with my degree, but I'm really happy I'm here, and I don't think enough people know about research and evaluation career tracks, so really happy to share all of that. So I started at UVM in August of 2020, and at the time I really thought I wanted to study nursing, but after I took Intro to Public Health in the fall of 2020, I was pretty much sold on studying public health, and I became a health sciences major in the spring. I minored in microbiology, and then I finished my degree in 3 years. So I graduated in May of 2023 with my BS in health sciences, which is now public health sciences. And then simultaneously, I started the Accelerated Masters of Public Health program at UVM, which I just completed in May. So pretty fresh here. And I started my job at PIRE during my last semester of undergraduate studies, and then that would make it about a year and a half that I've been with them. So PIRE is an independent nonprofit organization focused on merging scientific knowledge and research-based practices to create solutions that improve the health, safety, and well-being of individuals, communities, and nations around the world. Our mission is to promote, undertake, and evaluate activities, studies, and programs that improve individual and public health, welfare, and society. And in support of this mission, we create and support an environment within which skilled, innovative, diverse, and dedicated researchers and practitioners work to extend the frontiers of scientific knowledge and its application. And so PIRE has 6 centers across the US. And since COVID, I don't think a lot of people work in person in any of the centers. So a lot of us work remotely. I live in Vermont and I work out of the Chapel Hill Center in North Carolina. So my role is fully remote. And a lot of my role as a research associate is to work with senior staff to execute projects. And essentially, how it works is very confusing, very hard to explain. So I'm tried my best to write it out. So project officers will apply to RFPs, and then they build staff into each project. And we contract with clients at the state, municipal, local, and federal level. And my day-to-day work involves a lot of meetings with clients, my project teams, conducting qualitative and quantitative data analysis, collection, visualization. I do a lot of research, a lot of reading, a lot of literature reviews. It doesn't go away. A lot of writing reports, looking at grants, searching for funding opportunities, things like that. And some examples of my current and recent projects included in-person qualitative focus groups with fourth grade students for the Pennsylvania Youth Survey. Right now, I'm providing technical assistance for high-intensity drug trafficking area grantees, which is also called HIDA. And one of the larger projects I've worked on was conducting both quantitative and qualitative interviews with individuals who are actively using drugs in several states to collect data for Johns Hopkins University's Voices study, which was aimed at understanding racial and ethnic disparities in overdose risk and utilization of harm reduction and treatment services. That was a really interesting project. And that was to inform the opioid relief funding that a lot of different states got. And right now I'm also working with a team to create a Chief Health Equity Officer landscape analysis report for Centers for Medicaid and Medicare Services. I've done a lot of work on DFC and PFS grants. And again, research and evaluation was not something I thought I would end up in, but I'm really glad that I'm where I am. And I really enjoy working in this field because it's constantly changing. Projects are always changing. New things are always happening. And I really enjoy that I have a lot of independence. Working remotely has its challenges, but it's really awesome to have trust between my colleagues that we will all get everything done and it all comes together. And it's great to work directly to improve programs through research. And some of the skills and competencies most important to my role is analytical skills in SPSS also doesn't go away if you go down that track. Data visualization is a great thing to learn. All the Microsoft platforms, Excel, Word. Some other platforms that I use often, RedCap, Clear Impact, and Alchemer. And then lots of relationship building and interpersonal skills can be hard to not be face-to-face. So it's really important when working with clients remotely to really try and build a relationship, understand them better, and then it just works really well. Communication, time management, and organizational skills. There's been times I've been on as many as 7 or 8 projects at once. So lots of jumping back and forth and being ready to handle that, being really organized, especially working remotely. And then just openness to learn new things in the ever-evolving world of public health. And then a little bit about what brought me to public health. So, like I said, I wanted to go into nursing, but I was really turned away from the clinical field because rather than treating, I wanted to work towards prevention, education, and access. And I find endless inspiration and motivation to work in the field of public health. And I'm really grateful to have found my calling in life's work. And as I watch, and as we all do, the world around us grow unhealthier, I'm really motivated to do everything I can in my career to give back to the planet and the people whose voices cannot be heard. And I'm really inspired at the efforts of our field because we're working to create an equitable, healthier, and promising future for all. And I really like that we emphasize, meeting people where they're at and not trying to force anyone into any situation. Again, helping people live healthier lives through accessible solutions to care and education. And I have a lot of specific interest in like the sciences of public health, in microbes, infectious disease. And I really enjoy utilizing statistics and research methodology to problem solve sustainable methods to prevent infectious and chronic diseases. And lastly, and most of all, I'm motivated by the communities and individuals that I've had the opportunity to support and work with, and those I will work with in the future. So I don't know if that was 10 minutes. I think I was close. So thanks so much, and looking forward to any questions.
Thank you so much, Julia. That was great. I didn't realize that you had completed your MPH, but I see it after your name now. So congratulations on getting that done. But just to be clear, you got this opportunity with PIRE
Because of you.
while yeah, well, while you were still an undergraduate and then moving towards your graduate degree. So yeah, congratulations. So let's move on to the next. Again, I lost track of what the order is. I think that it was Geneva.
Yeah, it's me.
Yeah, good to see you. And I'll stop talking now and let you take over.
Sounds good. Yeah, thank you to Julia and Christel for sharing what you do. It's really interesting to learn what other UVM grads are doing. And thank you to UVM Public or Vermont Public Health Association for doing this. I think it's a great way to just kind of, I don't know, get to know what other people are doing in the field and learn from each other. So yeah, as was mentioned before, I'm a chronic disease prevention specialist with the Vermont Department of Health in the White River Junction local office. And I've been here about 2.5 months, so I'm still pretty new to it. A little bit about the local offices of the Vermont Department of Health. So the White River Junction office is one of 12 local offices that are around the state. And then at each of the local health offices, there's kind of a designated person in charge of a different area of public health. So there's a chronic disease specialist like me at each office. There are specialists in all sorts of public health issues, like family and child health. There's a specialist in school health, in immunization, in public health emergency preparedness, and more. So it's really great having colleagues who are subject matter experts in so many different public health topics, because I've definitely learned a lot from talking to others at my office. So that's a little bit of the structure of my branch of the Department of Health. But I can tell you a little bit about my background and what brought me to public health. So I graduated from UVM in spring 2023, so like a year and a half ago now, and I studied public health sciences, and then I minored in nutrition and food sciences. And I think it was at UVM that through my classes, I became really passionate about public health. I just thought it was really interesting to learn about the scope of change that can be made through this field. And I was also just found myself really passionate about the way that public health can intersect with related issues like climate action, climate resilience, social justice movements, and a lot more. And I think during my time as a student, I really tried to learn a lot about different aspects of public health. So I did a thesis on COVID vaccine hesitancy. I did research with one of my professors on waterborne disease incidents in a refugee camp. Then I also interned with Department of Vermont Health Access and Department of Children and Families as well. And now I'm really glad that I took that broader lens when I was in college, because my work as a chronic disease prevention specialist covers quite a lot of ground. Because I mean, if you think about the factors that prevent chronic disease at a community level, it ends up encompassing quite a lot. So I think the overall goal of my role is to understand what challenges related to chronic disease that our local communities are facing and how we can work to sustainably improve those challenges given the context of our communities, and how we can maintain those improvements effectively. So I kind of think of my role as having a bunch of different categories or almost like buckets of work, with the big ones being community health needs assessment, community healthy community design, workplace health, tobacco use prevention, and oral health. Although I also do projects around other public health topics like nutrition security, healthy aging, school health as well. But I'll kind of go through and tell you a little bit more about each category, and I'll talk a bit about the style of work too, because I think it's a little bit, unique. But so for community health needs assessment. So when local hospitals in our area do their community health needs assessment, which is every 3 years, I help them with that process. So I'll be able to help with the analysis of the 2024 health needs assessments from our local hospitals and share those findings with our community partners, things like that. Another category of work that I do is the healthy community design. And this is kind of the aspects of the built environment that improve the health of the community. So one thing I've been working on so far is starting to work with community organizations who are working to improve walk and bike access in our area. So things like improving bike trails and bike lanes, advocating for deteriorating sidewalks to be rebuilt so that they're more accessible, things like that. The third category of work that I do is workplace health. So I talk to local employers about how they can help their employees' health and well-being at work. And what that can look like depends quite a lot on the workplace, on their needs, their readiness for certain things. But just a couple examples. One project I've been working on is accessibility in workplaces. So I've connected with our local special needs support center to help get our own office and hopefully soon other employers in the area started on becoming more accommodating to those with disabilities. And then another project I've been working on with local employers is on breastfeeding friendly workplace practices. So I've talked to the leadership of a couple businesses in the area around developing policy about employees who are nursing or pumping and making sure they have spaces to do so at work during the day and flexible break times, and other things like that. Another category of work is tobacco use prevention. So that's a lot of things like promoting awareness of tobacco cessation resources at community hubs like libraries. And I've also been working on connecting with schools and some community groups that serve populations who are disproportionately impacted by tobacco use to develop tobacco use prevention and cessation resources and interventions that are tailored to the setting that they work in and the audience that they serve. And then the final main category of work is oral health. So I've been working with others in the community to try and figure out how to start to address the fact that so many people in this area, and in a lot of Vermont outside of Chittenden County, although in Chittenden County as well, a lot of people don't get dental care. They don't see a dentist regularly. And we're trying to think about what we can do that's going to sustainably allow more people to get care. And one thing I've been working on with that is working with our school health specialist here at our office to try to get more local schools in contact with in-school preventive and restorative dental services to get care for students who don't normally see a dentist. So I think those are kind of the different major categories of projects that I'm involved in. And it definitely seemed like a lot at first, but I think while there are projects that I'm leading or co-leading, for most of these projects, it's not me starting them up and directing the whole thing. I think that would be a lot considering the scope of my role. I think it's a lot more about integrating into pre-existing projects in the community and offering really whatever they need in terms of assistance, whether it's data, resources, guidance, connections with another group, doing similar work. And that's actually one of the things that I like the best about this role is that it involves working with so many people. It involves so many different aspects of public health. It's very dynamic in that way. And I really do feel like I'm never bored, and it honestly is. It's quite fun at times. You just get to work on so many different projects day to day. So I think that that makes it really engaging. Yeah, so I think that's it. If there's any questions, I'm happy to answer them. But yeah, thank you again to the people hosting this. Yeah, really appreciate it.
Thank you so much, Neva. Given that there's only one panelist left, I'm pretty sure of what the order is at this point. So, Lanie, hi. I'd like to welcome you to describe your current role in the organization that you work for.
Yeah, thanks so much, Ken. It's so great to see you. And Dan, thank you so much for all your work in the Vermont Public Health Association for inviting me and including AHEC as part of your panel today. As Ken says, my name is Lanie Billings, and I am the Health Careers Program Director for the Northern Vermont Area Health Education Center, or AHEC. My role focuses primarily on developing early pipeline programs that provide young Vermonters with opportunities to explore health careers and prepare for post-secondary pathways into medicine. A few examples of this work are represented through programs like the Governor's Institute on Health and Medicine, which is a 6-day, 7-day, 6-night residential program held at a college campus for students to come and explore what it is like to be on a college campus and also immerse themselves into different health topics. We also have the Hero Mentoring Program, which is a one-to-one program for high school students where they're matched with a medical student mentor at the Lerner College of Medicine. And we also have many resources available through our Vermont Health Careers website that allows students to do different activities related to health exploration. We also work with health professional students and providers to support them to become culturally effective practitioners, instructors, and mentors through programs like AHEC Scholars, which actually boosts residency applications to really emphasize that they've demonstrated that they've connected with communities in Vermont, specifically rural and underserved populations. As for me, my educational background is in public health and health sciences. I graduated from the University of Vermont in the spring of 2021 with my Bachelor's of Science for what is now known as the Public Health Sciences program. I'm also an advanced EMT by trade, and I've worked in emergency services for the past 7 years. I've been privileged in my time to be trusted with some fairly large leadership roles, specifically as the Director of Operations for the University of Vermont's Rescue Squad in 2020. This really cultivated my passion for public health in conjunction with the curriculum that Deb and Ken gave us in undergrad. But navigating the challenges and uncertainties through the COVID-19 pandemic really allowed me to build resiliency, understand the importance of public health services and interventions, and really appreciate the critical role that health workforce plays to support our population's health and well-being. I also had the privilege of instructing for the university's EMS programs, specifically for EMT and advanced EMT classes. This is where I found my passion for teaching, and it was my foundation for moving forward into health education at the Northern Vermont AHEC. As for the Northern Vermont AHEC, Northern Vermont AHEC is a health workforce development agency, and our mission is to educate and inspire students and professionals to meet the needs of all Vermonters. We are part of a statewide network with the Southern Vermont AHEC and the Office of Primary Care and AHEC program at the Lerner College of Medicine. Together, we work collectively to address health workforce shortages in rural and underserved communities in Vermont using strategies like educational loan repayment, paid internship, workforce assessments, and physician recruitment. AHECs are also part of a national model created in 1971 to address the need for well-trained health professionals, specifically in medically underserved communities throughout the United States. AHEC in particular does provide one of the 10 essential public health services, which is to build and support the diverse and skilled public health workforce, both in terms of creating public health network opportunities and for building health workforce networks within the clinical sector. My biggest motivator that continues to support my work in public health and workforce development is building connections to the aspirations of young people and the tangible steps that lead to make those dreams come true. When I first applied to become a part of Northern Vermont AHEC, I remember speaking about that light bulb moment that comes on when students grasp a concept that they previously didn't understand. Being able to see that connection be made, whether it's for a clinical skill or whether it's simply because they've learned something that they're newly passionate about or something that they want to pursue in the future. They're all building steps towards that person's career goals and post-secondary pathway plans, which is really what our programs are meant to do. My other biggest motivator is supporting community health and spreading resources among our rural and underserved Vermont communities to support their neighbors, really is what that comes down to. One of my favorite programs that we facilitate for young people is called First Aid Field Day. And at this event, students are learning life-saving stop the bleed skills and hands-only CPR, but also how to prioritize the treatment of different injuries based on how severe they are. And all of those skills not only serve as a pathway into discovering passion for medicine, but end up being transferable skills that can be brought back to their schools and communities to improve health outcomes, especially where there are provider shortages, which is increasingly getting higher each day. So I appreciate you all for listening, and I am excited to have the opportunity to answer some questions. And thank you, Ken, again for providing space to share about my work in the organization.
No, thank you all for like taking time out of your busy day to come and share what you do. It's really interesting. It's great to see all of you all. I want to give an opportunity to anybody, any students or otherwise, who would have some questions. If you could just use the, your little reactions thing to raise your hand, and then either Dan or I could call on you. If that doesn't seem to be working, you could just say, I have a question. And if there aren't any questions, I do have a question that I know that people should be considering. And I will pose it, but let me see. I'm gonna look in the chat, see if anybody. Nope. Any questions for our panelists? All right. So I do have one. I think it's kind of important, and I know that each of you put considerable effort into this because I worked with you on these things. But could any of you would you be willing to sort of speak to maybe any kind of hints or advice that you might give to other students who are on this Zoom call about the process of like how you found a job? Because a lot of the jobs that you have, Geneva excluded, they're not necessarily jobs where it was advertised as looking for an undergraduate public health major. So how did you think about finding a job, and then how did you get that job? So any advice from any of you on that?
I can talk a little bit.
Sure.
I don't know, being in the field, like what everybody else has said, and thank you all for sharing. I'm saying like that's so cool, that's so cool. But being in the field, I never really had the thought process of I know other people are like, well, what are you gonna do with that degree? I've never thought that, because I also want to go into law. So but even with a public health degree, there's so much you could, like, so much. I mean, you heard all of them speak. There's so much you could do. And I think before I like logistically speak about the process of like finding a job and applying, I was able to only get a job because of how I put myself out there during undergrad. So I want to say that the public health program, especially like when I started utilizing my emails, so they're constantly sending out opportunities, whether that's internships, go shadow here, go meet these people, panels such as these. Like, for example, if somebody were to reach out to one of us and was like, hey, do you guys have any internship or volunteer opportunities? Just like that, you could be set up for something in the future. So really being able to push yourself and advocate for yourself and ask questions. I learned that people want to help. So no one's ever gonna feel like, oh, this person keeps bothering me about a job or an opportunity. No, that like people love that. They want to see that you're eager to learn and you're eager to help out and you're eager to be involved. And so that's what I did. And it was genuine, the eagerness, but also it helped a lot. So if there's an opportunity for you to do something, for you to be somewhere, go and participate in that. And then there was my resume, and I didn't even realize that I had a like a good resume, because I was always that person that was going somewhere, being involved in something, just having an idea about something. And so then I had, like I said, I had this resume to put together and using my resources. So I'm a person that will find a way to get, like, I seek community. And I think that's a very important thing to do. And I don't have, what's it called? I'm not like an introvert, so I don't struggle. Like, I do get shy and I embarrassed and I'm timid at times, but I do seek out opportunities. And so like Ken and Deb and Noah from the public health program at UVM, I'm very close with them in my undergrad. And these people helped me because I was close to them, they were close to me. So like they're always there saying, if you need me, come to me. And so I went to them. And so they were able to help me navigate while I was still in undergrad, what life after graduating could look like. And so every opportunity they were helping me email, they wrote me my letters of recommendation to get me this job. I was with Deb and she was like, we were on the website looking at everything they wanted from my position. They were like, yeah, say this and tell them this and that you did this. And so really using your resources, like stretching out your resources, because remember, you're paying them. If you're an undergrad, you're paying them. So and they're in the field for a reason. They are passionate about helping students. So go ahead and exercise that passion that they have. And so then I just applied. There was a lot of applying and a lot of praying, some crying, because I applied a lot of jobs and I didn't get it. But this job, I love it so much. I didn't think I would. I knew I would get it. I feel like I just like had a feeling. But it took a long time. And I never stopped applying. And also, like, you could have, even if you get out of undergrad, you could have like I worked at Bliss Bee, great place. So I worked at Bliss Bee before this job. So don't like do what you got to do until you get your big girl job. So that's what I did. I hope I answered your question, Ken.
I would absolutely echo pretty much everything that you just said, Christel. The only other thing I would add to it is that, you know, your work can be your passion. And I think that that is such a good representation of what public health is and of the panelists that spoke tonight, because if we didn't like the work we were doing, we wouldn't take the time to talk about it, and be passionate about it and be excited about it, and, you know, have lots of positivity towards positively impacting our communities. My passion was in education, and I was able to move forward in public health education. And likewise for all of our other fellow panelists, it's so lovely to see the passion areas that cultivate your career. And public health is the perfect way to do that, even if you're not sure what you want to do, or if you want to become a practitioner later in life. You know, building that foundational knowledge within community health and public health topics, it will inform your practice if you become a practitioner later in life, whether it's a PA, a nurse, a medical provider, doctor, etc. It provides you with a different perspective that a lot of those students don't get. So it's great to be able to see that you can accentuate your passions and make a career out of them through this field.
Yeah. Um, I would just sort of maybe name a little bit what I think Christel was speaking to, which was she networked, right? Like she engaged in a lot of networking and she lined up her references, right? Like be thinking about that strategically. Who's going to vouch for me? And know that people that you work with, they want you to succeed, and get what you're looking for. So last, I want to open up the floor for other questions before we kind of wrap things up. So anybody got anything that you'd like to ask of any of the panelists? Last chance.
I'll jump in if no one else has a question. Thanks, everyone. Wow. I love listening to the four of you, and it just brings me so much hope for the field. And it's wonderful to hear about your passion and how you're applying your training and finding purpose in your work. So thanks again, as it was said, for taking the time to share with us. I'm curious to hear from you.
But wait, who are you?
Oh gosh,
Yes.
hi, I'm sorry, I'm Molly, she, her. By day, I'm at the University of Vermont Health Network, Community Health Improvement, managing health assessment and planning. If I can ever be a resource to you, I'll put my email in the chat. By night, apparently, it is dark now, I am the board president of the Vermont Public Health Association. So very happy to be with you all. Thanks, Ken. It's been a long day. So I'd love to hear from you all just briefly, as you're thinking about entering as young professionals into the field and you're establishing your careers, what are you looking for in a professional home, or what do you think is missing in the state or where you are to feel connected, whether it be events like this or other ways that you can deepen your networks, your knowledge. I know for me, being out of the field from getting my MPH, gosh, how many years has it been? Almost 10 years. So it's like, I'm always looking for opportunities to stay connected and relevant with new information and resources. So that's something I'm looking for, but I'd love to hear from you all. And thank you again.
And any of the panelists could jump in there and maybe say like, what are you looking for to support you in your career?
No wrong answer.
No wrong answers.
I can say something. I think one thing that has been really helpful about a helpful aspect of my position so far has just been I feel like there's a lot of educational opportunities in terms of like webinars, or we do office enrichment hours where, like today we had one, we talked about ageism. We talked about like that form of discrimination that I think we don't talk about a lot, but we work a lot with older adults in the community. And I feel like that's a really helpful thing for us to talk about. But just, I think one thing that's been really great is how open people are in my office to learning new things. Even people who have, our district director has been in medicine and public health for a super long time. And even people like that, everyone's really been open to kind of learning about what disparities we're facing in Vermont, and being real, I don't know, interested and curious, and interested in kind of developing our skills as an office. I think has been a really positive aspect so far of this for me.
Wonderful to hear, Geneva. I'm happy for you that you have such a supportive environment. Sounds enriching. Yeah, great.
I also want to say something. I feel like there's more of what you guys orchestrated here happening frequently. I know you guys said that this is the first of many, but just if we had more like people at the same timeline, so like more recent grads and more people like in the similar age groups coming and telling us about these opportunities, and then being able to like exchange like LinkedIn's or emails and like or like form connections, and then networking with people who are, because I might be intimidated to like, somebody else might not want to go up to Ken and like take him up on his offer, but like somebody might be less intimidated to come up to me for a multitude of reasons and be like, hey, how did you do this? And so like just opening the space, like even at work, like where I'll be there, I'm like, I don't want to step on anyone's toes, not yet, but like I think if I can like also go into these outreach places and say like, hey, because while there are young people experiencing it, the age is more prevalent in I think it's like 18 to 22 or 18 to 25 experiencing domestic violence. There's also, these people also need to see that like how I got to this job, and like need to hear how like how school wasn't easy, but I got to this job because I networked, and only because I networked. So that's what's I feel like is missing. There's not enough people going back into like classes or like communities and being like, hey, this is what I'm doing now. This is how you can do this or something like this or something else.
Really helpful. So like accessible opportunities for young professionals, like-minded professionals to exchange information, talk to one another. It sounds like that's great. Yeah, totally. I'm sorry, I think I said your name wrong. It's Neva. Sorry, I said
It's
Geneva.
Neva or Geneva,
Yeah, I'm
either
so
one.
sorry. Yes, I messed it up. Great.
And I totally agree with all those things. And I want to go back to Ken's point or question. Agree with networking. Ken helped me get the job that I have now. And another big piece of advice that I've kind of learned along the way is as you're applying to jobs and everything, because it's such a big field and there's so many things you can do, just getting in somewhere is what matters the most because you'll learn, at least at my organization, with people that have been in the field for years and years, everyone's path is so crazy. People started working at the health department and then they did this and then they did that. And like the world is your oyster once you get in to the public health field and you can always move around and switch and try new things and go back to old things. And I think that's what's so awesome about this degree. And that's just my biggest piece of advice is just stay open and go into it without expectations because you'll get to where you want to be at some point.
Yeah, I think that's really good advice. I mean, the field of public health is so big and there's so many ways you can go with it, and that's great, but it also can make things difficult because people get to public health from so many different kinds of pathways and backgrounds. Um, I didn't even know that I worked in public health until someone told me because they're like, "Oh, the work that we're doing is public health." I'm like, "Oh, really?" And I don't even have I don't have an MPH. I didn't do an undergraduate degree in public health. Um, and so that's one of the reasons why we want to do this is to kind of help people understand that like there's a lot of jobs out there that the employers are looking for people with exactly the kind of skills and knowledge that you get in an undergraduate public health program, but they may not necessarily be advertising for a person who is a public health they may not use that term in their job descriptions. So, with that said, we're almost to the end of our time. I just want to say thank you again so much to the panelists. I look forward to us getting together and seeing each other in person sooner than later, I hope. But really, thank you so much for showing up, and I hope this was useful for those students and community people who came in for the presentation. Thank you so much.